Bismillahirrahmanirrahim. Assalamu alaikum. Today we are going to discuss the sacroiliac joint and innominates. So in this short model, we are looking at the two sacroiliac joints from the posterior side, and we are also looking at the innominate bones, and some part of the hip joint is also seen. Now it is important to remember that we are looking at from the posterior side. Here you can see this is the right sacroiliac joint and this is the left sacroiliac joint. Here you can see the fused bones of the sacrum, and this is the tailbone which is called as the coccyx, and now this is the side view. So there are some movements that are called as the primary movements, and these movements are very important to understand and very easy to understand. These movements are carried out in relation to the pelvis or the innominate bones. These movements are called as the nutation. The sacral base is on top and this is the apex. You can say it is just like an inverted triangle. So the apex and the base. So nutation is such a movement in which the base of the sacrum goes forward and downward, and the apex, it goes posterior and superior. So if the sacrum is moving anteriorly, just like this, just like my hand, then we will call this movement as nutation. This motion or this movement is relative to the innominate bones or the ilium. Now the opposite of this, which is called as the counter nutation, which means that the base of the sacrum is moving superior and posterior while the apex is moving anterior and inferior. So these two movements are the movements of nutation and counter nutation, which are basically accompanied by the movements of lumbar spine and the movements of hip joint. For example, when a person is performing knee to chest or the William flexion exercise, there is counter nutation of the sacrum. While when a person is performing Mackenzie extension exercise, there is the nutation of the sacrum. Now there are some other problems that or the movements that we need to understand, and these movements are if the sacrum is moving anterior to the innominates as compared to the innominates. If the sacrum is moving anteriorly, it is called as anterior shear. And if the sacrum is moving posterior as compared to the innominates, then this movement will be called as the posterior shear. There can be also upslip, that the sacrum might move up and the sacrum might move down, which is called as the upslip or downslip. It is sometimes referred to the movement of the ilium, and sometimes people refer it to the position of the sacrum as well. So I'll repeat these motions or movements: nutation, counter nutation, then there is anterior shear and posterior shear, as well as up glide and down glide of the sacrum. When the sacrum moves, it also affects the innominate bones, or it also affects the hip joint. So how it affects that? With the movement of nutation, these two brims of the pelvis tends to open to this side and to this side, means just like a flower. So the sacrum, when moves into the nutation, the pelvic brim, it opens, which is called as the out flare, which this position is called as the out flare, or the pelvis, it widens. When the sacrum moves into counter nutation, there is in flare movement of the innominates, that they squeeze towards the midline, and this is called as the in flare. And if you look closely, you will see that the sacrum is not only affecting the lumbar spine or the innominates, but also it is affecting the hip joints, and on the anteriorly it can also affect the symphysis pubis. So this is a very important bone in the human anatomy, and it is also the foundation stone for the spine. So a lot of problems are related to the position of sacrum, and even the slightest mechanical dysfunction in the sacrum can lead to severe problems and pains. I hope you like this video. Thank you very much.